Learning objectives. By the conclusion of the presentation, the learner will be able to define what class standards are, describe CLAS Standard 6, use the crosswalk appropriately, question if the class standard is effectively implemented, support the learning objectives. Provided in the patient's preferred language at their level of health literacy and meets their communication needs. The class standards consist of the principal standard discussed on the previous slide and 14 other class standards. According to Thobain 2003, the first 7 standards directly affect care, and the last 7 standards involve organizational structures and policies that support the first 7. According to the first is governance, leadership, and workforce. The second is communication and language assistance. And the third is engagement, continuous improvement, and accountability. You may be asking yourself, why is this necessary? Why were these standards even initiated? If you look at the population of America and how culturally diverse it is, you have your answer. According to Coe, Garcia, and Alvarez, other than English at home, and 9% had limited English proficiency. When you think about how complex some of the instructions we have to give patients or their families are for their care, you can see why this is an issue. It's definitely a patient safety issue. The standard I chose to further explore was CLAS Standard 6. Inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. The reason I chose this standard is while all of the standards they aren't able to utilize them. The healthcare setting that I chose for this project was home health. I've worked in home health for many years and know the challenges involved with it. In home health, you have far fewer resources than in the hospital. So let's take a look at how my home health agency implemented and addressed CLAS Standard number 6. Home health gets their referrals primarily from the hospital, with some from the community, such as doctors' offices and long-term care facilities. At the hospital, before the patient is discharged, one of the home health liaisons for our company goes and talks with the patient and assesses them for needs. One of the needs that they assess for is for an interpreter, if there is a language barrier. If they identify that interpreter services were needed, they would relay that information to the branch so that the start of care nurse or case manager that was going to go do the admission could set those services up beforehand. The policy was that the patient is screened at the time of referral and prior to admission for needs. That way, if they were identified, everything would be set up for the admission. Also, the patient and the family was informed at the time of referral that the services are available. In addition to that, the admission booklet that they're given at start of care has full information written in their language about the services available to them. Let's use the crosswalk to see how my home health company measures up. Patient: has someone from the practice ask you if you need an interpreter? The answer to this should be yes, as our policy is that they get screened at intake. Staff: were patients who needed an interpreter offered one? Again, this should be yes. Since the patients are screened at intake, needs should be identified prior to admission, and those services can be set up in advance. Policy: is it practice policy to have staff ask patients if they need an interpreter? Yes, our home health policy is that they are screened and asked if they need interpreters. Policy: does the practice post signs informing patients that free language interpretation is available? Since home health is not an actual building and takes place inside the patient's home, the answer to this is no. However, since that information is available in the admission booklet in the language that the patient would be speaking, I'm going to say yes. Things that my home health company did well in regards to meeting CLAS Standard number 6 were having the available services, also having the screening policies, and then having the materials in the language that the patient would speak. Areas for improvement for my home health company would be having annual in-services to refresh staff knowledge regarding the services, because they are so infrequently used, and as you know, when you infrequently use something, you can forget a lot of details about it. Also, initial staff training could be a little bit more thorough in regards to how to initiate these services if they're identified as needs.